crazy the difference. And it's all filled in. See?
Hey, Chris. How you doing, man?
Good, Nick. How are you?
Yeah, doing well, man. Hey, it's been a long time coming. I got some I got some before photos I want to share with everybody. This is Chris before the operation.
Mm-hmm.
Man, what's going on with your hair?
I was just evacuating. It was
Leaving the
it
scene.
was just running away. I don't know. It was driving me crazy, and it was painful to find a hairstyle that would look good. A haircut. Just going to get my hair cut, it would. If they cut it too short, then it was obvious. If it was too long, then it just looked thin. It was just a nightmare. There was no. The only solution was to wear a hat, and like I can't wear hats everywhere all the time. So, yeah, it just eventually became the only option for me at a certain point. And when I did it, like I had zero regrets. Like I told you before, like it was probably the best money I've spent in a long time. Um, and I refer all my friends to it. I tell everybody about it.
Well, with the product, you put the product in your hair. I mean, was wind ever a huge factor with you? Did you ever find that
Wind?
kind of yeah?
Oh, I hated windy
big
days.
breeze. Yeah,
Hated
like,
windy days.
and what about? I mean, you're a single guy, right? How was dating life with hair thinning? Were you having to go dates with a cap on, or how would that
No,
affect?
I mean it wasn't too bad. It wasn't as. I mean, it was a confidence thing for me. So like I was I was self conscious about my hair, and it was just always something that was kind of like lingering in my head. Like if I was on a date or something, or if I was just out at a dinner, or out with friends, or just wherever I was, if somebody took a picture or something, and I would see it in the picture, and it would look bad, and it was just one of those things that was constantly. It was like a moment of dread almost, where I just didn't like it, and now I'm at least happy. You know, whenever I go out, whenever I do stuff, I don't worry about my hair anymore. I don't worry about how it looks. And then when I see myself in a picture, I'm genuinely happy with the way it turned out. Um, but before, yeah, it was just it's a terrible feeling. I mean, nobody wants to lose their hair, and then if it starts like falling out in a weird way, you know, whether you get the crown fall out, or the widow's peak, or you know, mine was the widow's peak and then the thinning in the front. So it wasn't even like I had a strong like hairline up here. It was receding and thinning in the front, and I just didn't like. There's no hairstyle for that. There's no way to make that look good, right? So, yeah,
That's tough. You're pretty fit too. You watch
yeah,
what you
yeah.
eat too. You didn't want to even put not real sugar in your coffee, right?
Yeah.
So you're health conscious, and you know you can do so many things to improve your basically your quality of life by exercising. But for whatever reason, naturally we can't really like regrow our hair.
Yeah,
So it's frustrating, right?
very, especially when it grows everywhere else on your body. My hair's just started growing on my back and not my head. I don't understand. Why is this happening? um, but yeah, I mean, for me, it was just like it's that expression. You know, if you look good, you feel good. If you feel good, you play good. If you play good, they pay good. And it's just like that in life and everything else. I feel like if you look good, or at least think you look good, then you're gonna feel good. It just goes hand in hand. And the better you feel, the better you're gonna act, the better you're gonna perform, the more people are gonna want to be around you, the greater your success will be, so on and so on. It's just like it's a positive mindset.
Yeah, compounded.
But if you have this insecurity about yourself, about your appearance especially, because it's the first thing you put on for people when they meet you or when you're seeing somebody, is your appearance. And typically we're all judged by our appearance, and then immediately you start thinking, well, my hair doesn't look good, then I don't look good. If I don't look good, I don't feel good about it. I don't want to go out. I want to stay home. Now I'm depressed. So it does. It's compounding. It rolls over into so many other things. Um, since the hair transplant though, and it's all grown in, I feel it's like a new lease on life, kind of. I look forward to going out. I look forward to, you know, being at events or teaching my yoga classes, especially when my hair gets like super sweaty and it's crazy. At least it doesn't look bad. It's still full head of hair, so there's no self-conscious like, oh no, I wish I had a hat on or a headband or something to cover this receding hairline. So yeah, for me, it just boiled all the way down to confidence and just how I felt about myself.
What about age? Like, did you feel like looked a little bit older with your hair? When
Absolutely.
when people would guess how old you were they guessing the higher numbers?
Absolutely, yeah. I used to love playing that game because I look a lot younger than I am. So like when people would say like, "How old are you?" and you tell them, or you ask them to guess, and they're guessing like 10 years younger, it's a good feeling. But when they start getting closer to your actual age, that sucks. And then every once in a while, somebody will throw you a number that's just past your age, and that's when it really sucks. That's when it hits hard.
As far as the operation, how was the process? Was everything smooth?
Oh yeah, it went great. I showed up early, about 8 o'clock in the morning. We got started about an hour or so later after we did, some more consult and just kind of like mapping the whole procedure out. I think it was about an 8-hour procedure.
With 1,700 grafts.
We did about 1,600 grafts. Yeah, between 16 and 17. I think he threw a few extras in there. Drove home.
Can't beat that. How far was the drive?
About 45 minutes.
Okay.
So yeah, it wasn't bad at all. Drove home. Head was still numb, and
you stacked the house full of snacks.
Yeah. Just hung out at the house for about a week. Just laid low. Didn't do too much. Very easy downtime.
Uber Eats come in handy?
Yeah, Uber Eats was great. Yeah, it wasn't too bad. Trying to think, there was not any pain. I don't remember ever feeling like, ow, like this sucks. It is kind of tricky if you sleep on your side a lot. You want to sleep on your back. Obviously, kind of keep the head elevated a little bit because you don't want to roll over on the grafts during that first week.
Bleeding afterwards?
No, the scabs came in nicely, and there was no bleeding. The scabs held strong until I had to come back. I think it was like 10 days later. And
7 days. 7 days on the day he came back in. We took off pretty much all those scabs.
Yeah, had them all removed, and then I was speaking at an event. I think within 2 weeks of the procedure.
What?
Yeah, it wasn't.
Did you do any cardio immediately after the operation?
No. I went home and just crawled into bed and turned on the TV. Like, I have the next few days to do nothing. This is great.
So everything went smoothly. Grass finally grew in. It took what? When did you think you started seeing the result?
I was starting to get really excited. I remember around that 6-month mark. It was around the 5 or 6 months. Everything was starting to grow in. I had gotten a haircut. It was kind of evening out. And yeah, I try to think. I used to wear hats all the time now, and now I think I keep one in my truck just to have for whatever reason, but I don't wear hats hardly ever anymore. And that's a cool feeling. My dad had 2 hair transplants. Well before, I knew about the
FUE.
The FUE. He had the one where they cut the strip out of the back of your head and then implant a strip on the top up here, which was very invasive. I remember he came home. It was a whole day procedure. He came home, head wrapped up like a turban, just out of his mind on painkillers. Like it was pretty comical actually. Um, the poor guy, he was bedridden for some time, like at least a week. The whole healing procedure was just brutal. They had to constantly change his bandage. There were stitches. It was a whole thing, and it didn't take.
And it didn't take. Oh
And
my
it
God.
didn't take. And he did it twice. And I'm like, and he
Same
looks.
place.
I don't know if he went this. I think he might have gone to the same place, but it sucks because like he's like 80 years old now, and now that I've done this, like he asks me questions all the time. Like, I was like, Dad, like I think it's a little late for you to do the FUE because his hair's so thin already, and he has really fine hair. But he just his donor side. I'm like, at this point, at this stage, you're good. You're good. Just let it go. But I did tell him about the tattoo exosomes
Yeah.
just to see, because I don't know what that would look like for a person in their 80s who,
So I mean, as long as the follicle's still there, we can turn it on. But like you said, once you get older,
Yeah.
you're less likely to have that stem cell population.
yeah, and you're less inclined to want to spend the money to look. I mean, come on.
You'd be surprised. I mean, I got 90-year-old patients.
Yeah.
Money's not the problem; it's the donor supply.
Yeah,
That's really the big issue because it's limited. That's why I look at results online. Other clinics, they just go in there one pass, 5,000 grafts on like a 26-year-old. Like that guy's he's set up for failure down the road. Not much we can do.
5,000 grafts on a 26-year-old.
They do that. They just go rampant. It's enough.
Poor guy. Yeah. So my buddy that went to Brazil, he did 4,000 grafts.
Yeah.
And they did the top of his entire head. And now the side of his head looks, it's very like thin. Like you can kind of see his scalp. You can see through the hair, even though it's grown out a lot since the procedure.
They'll say, well, we're going to do 4,000 grafts, but we'll do five or 6,000 extra cases too. Every patient's different.
Yeah.
Some guys, the grafts change below the skin and the angles change, so you transect a lot of them. Other ones, you just go right over. It comes out no problem. There's guys we wish we charged less for their operation. There's guys who are like, we should charge double. This case was so hard.
Yeah.
You don't know until you get in there.
Yeah. Yeah, I feel like mine was pretty easy. I don't remember them having any moments or.
No, I didn't see any complaints in the chart. I think everything went smooth.
Yeah, I will say I do know that the finasteride, whether topical or not, I would recommend that after a procedure. Because I didn't when I had mine first. I don't know if you remember when I came in and I was like, oh no, like I'm starting to see shedding again. Like in the shower, I would see it,
Right,
and then
yeah.
y'all got me on the finasteride, and it literally stopped like that week. I didn't see anything, and now it looks full again. So I'm glad I caught that at that moment because that sucked.
Yeah,
That was a terrible feeling.
Like, all right, you ready for your touch up? It's only
Yeah, because I
been
think I
6
came in
months.
and y'all were like doing the test and everything, and you said, "Oh, it's thinning out a little bit up here," and I was like, I could feel it. I could feel it when I washed my hair, and now that the finasteride started, I'm real curious to see what the numbers look like another month after that, because I think it's gotten thicker since the last time we actually did the test.
Good.
So.
And it plateaus. You'll be staying for a while. And the bone
Yeah,
will stay
I think you
for a
said I
while.
was in a cycle or something
Yeah.
last time, where sometimes it sheds and then it'll grow back. So yeah, I'm not too familiar with the whole.
But hey, we don't know. We don't know, to be honest with you. It's
Yeah,
just a
yeah.
guessing game. But it's great to be on the medication. It's just another way to target it because we're throwing a lot. We're trying to do the Alpharetta treatments, so it's accelerating your growth a little bit.
Yeah.
But it's not called attacking the root problem, which is DHT. All right, testosterone levels. High testosterone levels attack the follicle.
Is there a test for that for DHT?
To determine what you respond best to, there's a tricho test. You swab the inside of your mouth, and it tells you if you respond to finasteride, dutasteride. But as far as DHT or testosterone, you just do general blood work.
Okay, yeah,
It'll tell
yeah.
you what your levels are. What
So
they're
is it
low.
all kind of affiliated with your testosterone level? So
Predominant. So like the guys that get on HRT, they tend to notice more shedding if they're not on anything. That's one of the scary things about you go to your hormone doctor and say, yeah, I'd start taking this medication, and a year later, like, hey man, my hair's falling out. I'm like, he didn't tell you could lose your hair if you're on HRT.
what's the things that it's the stuff they don't tell. Which is another reason why we're like Dr. Cole, because he has sometimes in conversations with him, I almost feel like he's trying to convince me not to do it. You know, like it's almost like the opposite of what you would expect to hear your doctor say. Like, you need more. He's like, actually, I think you don't need that many, or you need less. Because I came in, I was expecting to do, I think, like originally I wanted to do a lot more than what I did.
I think you wanted to do 2,500.
Yeah, I wanted to do like 2 or 2,500. And when he came in and he saw me and like actually like looked at me and was like, 1,000. It's like, I wouldn't want to do this much on you. And then he went into why I shouldn't do it. And I was like, okay. I think most places would just be like, okay, yeah, 2,000.
Yeah,
give me your money. Yeah, give me your money.
It's just where you want the design and the way
Yeah.
you comb your hair. I mean, I don't know where your hairline starts. It's perfect. You didn't have to be all that aggressive.
Yeah, no, it's like, it's literally, you know,
Oh, yeah.
it's
really good.
pretty good line, yeah.
Yeah, it is a really good line.
Especially when you see the before and after photos. It's wow, like, who is this person?
Yeah,
It's crazy.
if we pull this up, you can see we brought it down like 2 centimeters too. With
Yeah,
like
yeah,
1,500. I'll show everybody that. And I mean, that's a pretty far dip all the way across here. Yeah. That's what's cool. You're able to do a lot more with less.
Yeah.
I mean, I can show you a result online. This is a buddy of mine. I'm going to go to someone else that's also very good in the Atlanta area, or he's supposedly very good. And he paid for 2,500 grafts, and the result looks like 1,000 graft transplant, 800 to 1,000. I mean, he was completely bald in the front. 2,500 should have been a full frontal hairline, see through, really thin. He paid. He's a salesman. He paid a really dirt cheap price, $4 per graft for an FUE.
Wow.
The robot did the operation, and that's why the results were so terrible. The robot transected so many of his grafts.
Robots.
Before he came in here, he spent the same amount of money he did on his first transplant for 1,000 grafts, and it's a full front, like it's a home run result.
So he did end up coming back here. See, that's the thing. That's what I didn't want to happen, was to spend the money on anything and not get the result that I wanted. So, yeah, it was actually, funny enough, it was my mom that found you guys.
Yeah.
Because I originally had told my mom, I was like, yeah, I think I want to go to Turkey. We'll make a trip out of it. It was me and one of my really good friends at the time. He did all the research. He'd had friends that went and did it. We were actually had started talking to a couple of clinics. I think one of them was called Smile Clinic or something. All out of Turkey. And then when I mentioned it to my mom, she lost it. She was like, absolutely not. She's like, there's no way I'm gonna, other side of the world and having a procedure like that done. So she got on and started doing all this research, found Dr. Cole and was like, this is the guy that invented the procedure and like made the tools for the procedure. Don't you want that person to do it? And I was like, obviously, like, I am a person of quality over quantity. So yeah, if he's like the best in the world, absolutely, that's who I want to do it. But how realistic is that? I'm thinking like, this guy's booked out for the next probably 5 years, or it's crazy expensive, or so many different things why I wouldn't be able to get that appointment. And then I remember, I can't remember if I filled out a form online or just reached out. And I remember talking to you, and then you dropped it and said, called your dad the Tom Brady of hair transplants. And I was like, all right, that's sold. I was like, he's right. I want the GOAT to do my hair transplant. So, and then, yeah, now having like met you and your dad and the whole team, and yeah, I'm so happy I came here instead of anywhere else.
No, chances of success were a lot higher. I can tell you that much.
Yeah.
You basically eliminated a lot of room for error. Now, don't get me wrong. I've seen great results come out of Turkey, even from the clinic you mentioned. But it's one of those things like you hop on Reddit, you start looking at the forums. 3 out of 10 patients turn out to have a good result. It's low chances, and you just see the guys with the good results publishing all the time. So the guys that get butchered, they're like, yeah, I'm just gonna crawl into a cave.
Well, that was one of the other things. So a lot of the research we did was from Reddit, or just internet forums, and some of the ones that I read, though they were few, they were terrifying. Yeah. They were infections. They were bad anesthesia.
Yeah, you can get anesthesia poisoning.
Yeah, poisoning. There were so many things, and when
sterilize their equipment, they don't have some regulations.
And when you're in another country like that, you don't speak the language.
They're protecting their medical tourism. You can't go after them.
Absolutely. So you're not protected in any way. And then the other thing that I didn't like was, so they do the transplant, and then you come back the very next morning for the cleaning, and then they throw you on an airplane and send you home. So if anything goes wrong after that, I have to now try to reach out to these people in Turkey on the other side of the world in a different time zone than me and hope that I can get the help or care that I need, versus to have you guys, which are, 45 minutes away from me. I was coming in the first month, I think I came in 3 different times, then I've come back every month since then just for a checkup, a test, a follow-up. So it's the aftercare that really got me too. That was a huge selling point for me, because I just, this isn't something you want to skimp on. Now there are definitely, products, there's things in life that I think you should always shop around, find the best deal, barter, haggle, do whatever you got to do to kind of come out a little bit better than the asking was in the first place. But in a procedure like this, something that's invasive, something that's a long duration of time, something that's going to alter the way you look for the rest of your life, don't skimp, don't hold out on that. Don't look for the best deal, because something that's always true in every aspect of life is you get what you pay for. So if you want something done quick and done cheap, don't expect it to be good.
It's with any cosmetic surgery, though, to be honest with you. I see it all the time with facelifts. Like, people, there's a big difference between a $10,000 facelift and a $100,000 facelift.
Yeah.
Yeah, but even like you said, it's going to be the first thing people see when they look at you, Do you want it to look like you had a hair transplant, or do you want to look like, hey, your hair looks really good. Hey, how old are you now? Mm-hmm. What are you doing?
Yeah.
You can say anything you want. I'm on my medication, or I just never got old. Found the fountain of youth. I wouldn't be able to tell you had a hair transplant. It looks great.
Yeah, see, I would tell everybody, because it's like, look, this is, it's available to everybody. And I think, even now, if you don't have all the money up front, you can take out, cosmetic surgery loans and stuff. There's different credit agencies that you can even borrow money on to do it, and it's pretty low interest from what I hear. So if I didn't have the money at this point in my life to just pay it outright or just put it on a credit card, I would have taken a loan out for this procedure 100%.
Well, but you did an FUE, and there's another advantage to that. We can do small sessions too, like 300 graft sessions. And I literally have a guy 10 minutes down the road, and he comes in every 6 months and does 300 grafts. And over the course of 4 years, eventually achieved a full head of hair. Yeah.
What?
Yeah. And it's cost him the same amount of money to do it in small steps as it did to do it all at once. Yeah.
Man.
And he was in good shape. You come in here, do 400 grafts, go right back to work. He was doing no shave every time, just hide everything.
Okay.
Yeah.
Well, that may be my, insurance policy there. I'll just come in every so many years and do a little 500.
Yeah, if you don't stay on the Propecia, then we'll have to do that maybe. We'll see.
Well, hopefully I don't, but,
Yeah. Good, man. Awesome. Well, it's getting late. I got to get to work. I appreciate you coming.
Oh, my God, yeah. that we just killed some time there. Holy crap. All right, cool. Well, hey, I got my coffee now. I was like, nothing else matters. I'm good.
Well, hopefully they hit the record button.
That would have been funny.
We're good.
That would have been so funny.